The best ways of monitoring your diabetes control is by home blood glucose testing and by having a HbA1c test. The HbA1c test is done at your doctor's or hospital appointment. It shows you how well you've been controlling your blood glucose over the last 3 months. So I normally have it done 3 or 4 times a year. People without diabetes would normally have a HbA1c result of 24 to 42 millimoles per mole. Most healthcare professionals suggest that a person with diabetes should aim for a HbA1c result between 48 and 58 millimoles per mole. And if you are under 16 years old, you should aim for under 58 millimoles per mole. But we know that this can be difficult to achieve and takes time, especially if you are newly diagnosed. Your individual targets should be discussed with your diabetes nurse or doctor. If your HbA1c is higher than your agreed target level, we know that your blood glucose is high more often than it should be to stay healthy. In diabetes, your aim is to maintain a healthy level of blood glucose throughout the day, not too high and not too low. This is why monitoring your own blood glucose is so important. It tells you your current blood glucose level on the spot, so you know what to do. The test you do with your meter helps you understand how different foods and activity affect your blood glucose, and balance your food and activity with your insulin injections, so you're not too high, hyper, or you're not too low, hypo. So, HbA1c is the long-term assessment of your control, and home testing gives you the information you need for day-to-day diabetes control, which in turn will help you achieve your target HbA1c. Both are important when making choices about how to manage and treat your diabetes. One more thing, if your blood glucose is too low, it is called hypoglycemia or hypo, and if it is too high, it is called hyperglycemia or hyper. You may be able to tell when your blood glucose is high, hyper, because there are symptoms including feeling very thirsty or weak, or your vision might be blurred, or you may be urinating a lot. Likewise, if your blood glucose is too low, hypo, you may feel very hungry or weak, or be sweating more than usual. Speak to your healthcare professional if you would like more information about signs and symptoms of hypers and hypos and how to treat them.